Most of us are too familiar with the painful burning sensation in the center of the chest that's associated with heartburn. What is acid reflux and what are the symptoms? Acid reflux occurs when acid is pushed up from the stomach back into the esophagus, which leads to the heartburn sensation. The most common symptoms of acid reflux is heartburn. Those who often experience acid reflux, 20 to 40% are diagnosed with gastroesophageal reflux disease. Although people often use medications to treat acid reflux or heartburn, many lifestyle modifications can also help you reduce symptoms and improve your quality of life. Here are 10 natural ways to reduce your acid reflux or heartburn, all backed by scientific research. 1. Chew gum. A few old studies have shown that chewing gum may help decrease acidity in the esophagus. Chewing gum causes an increase in saliva production. Gum that contains bicarbonate appears to be especially effective as it can help neutralize acid to prevent reflux. 2. Eat dinner earlier. Healthcare professionals often advise people with acid reflux to avoid eating within the 3 hours before they go to sleep. Eating a late night meal increases acid exposure when lying down by 5%, compared with eating earlier in the evening. A study including 817 people with type 2 diabetes found that eating dinner late at night was associated with a higher risk of acid reflux. 3. Don't drink too much citrus juice. Many types of citrus juice, including orange juice and grapefruit juice, are considered common triggers for heartburn. These ingredients are highly acidic and contain carbons like ascorbic acid, which could cause indigestion if you consume them in large amounts. In addition to being acidic, certain compounds found in citrus juice could irritate the lining of the esophagus. While citrus juice probably doesn't cause acid reflux directly, it could make your heartburn worse temporarily. 4. Maintain a moderate weight. Achieving and maintaining a moderate body weight can help reduce acid reflux in the long term. The diaphragm is a muscle located above your stomach. Normally, the diaphragm naturally strengthens the lower esophageal sphincter, which prevents excessive amounts of stomach acid from leaking up into the esophagus. However, if you have excess belly fat, the pressure in your abdomen may become so high that the lower esophageal sphincter gets pushed upward away from the diaphragm support. This condition, known as heterothermia, is considered the leading cause of gastroesophageal reflux disease. 5. Don't drink too much coffee. Studies have found that coffee temporarily relaxes the lower esophageal sphincter, increasing the risk of acid reflux. Nevertheless, although several studies suggest that coffee and caffeine may worsen acid reflux for some people, the evidence is not entirely conclusive. Similarly to coffee, caffeine relaxes the lower esophageal sphincter, which could cause acid reflux. If you found out that coffee gives you heartburn, it's best to simply avoid it or limit your intake. 6. Elevate the head of your bed. Some people experience reflux symptoms during the night, which can affect sleep quality and make it more difficult to fall asleep. Changing the position that you sleep in by elevating the head of your bed could help reduce symptoms of acid reflux and improve sleep quality. Another study showed that people who use a wedge to elevate their upper body while sleeping experienced less acid reflux compared with when they sleep flat. 7. Limit your intake of carbonated beverages. Healthcare professionals sometimes advise people with gastroesophageal reflux disease to limit their intake of carbonated beverages. One study found that carbonated soft drinks in particular worsen certain acid reflux symptoms, including heartburn, fullness, and burping. The main reason is that the carbon dioxide gas, the bubbles, in the carbonated beverages causes people to burp more often, an effect that can increase the amount of acid escaping into the esophagus. 8. Limit your alcohol intake. Drinking alcohol may increase the severity of acid reflux or heartburn. In fact, some studies have shown that higher alcohol intake could be linked to increased symptoms of acid reflux. Although new research is needed, some old studies also show that drinking wine or beer increases reflux symptoms, especially compared with drinking plain water. Excessive alcohol intake can worsen acid reflux symptoms. If you experience heartburn, limiting your alcohol intake might help ease some of your discomfort. 9. Do not sleep on the right side. Several studies have found that sleeping on your right side may worsen reflux symptoms at night. In fact, according to one review, lying on your left side may decrease acid exposure in the esophagus by up to 71%. On the other hand, when you lie on your right side, stomach acid covers the lower esophageal sphincter, increasing the risk of reflux. While sleeping on the left side all night may not always be possible, it could help make you more comfortable as you fall asleep. Finally, follow a low-carb diet. Growing evidence suggests that low-carb diets may relieve acid reflux symptoms. Having too many undigested carbs in your digestive system often can not only cause gas or bloating, but also burping. In fact, some researchers suggest that undigested carbs may cause bacterial overgrowth and increase pressure inside the abdomen, which could contribute to acid reflux. However, poor carb digestion and bacterial overgrowth in the small intestine may result in acid reflux. Low-carb diets may be an effective treatment, but further studies are needed. Subscribe to my YouTube channel. Don't forget to like, share, and comment for more videos.